Okay, attachment release for the upper traps. Now you don't have to do a trigger point release before you do attachment release, but you do want to make sure you've thoroughly warmed up the muscle. So stripping through that muscle several times, doing a little bit more than just your general Swedish. And with attachment release, what we want to do is we want to friction at the origin and the insertion of the muscle. First, we're going to do a longitudinal friction in the direction of the muscle fibers, followed by a cross fiber friction in the opposite direction of the muscle fibers. Now, for the upper traps, it's got kind of this, we're pretending upper traps is its own muscle. So we're going to do our frictions kind of right off of this AC joint, right where the spine of the scapula and the clavicle are coming together, right here. Then we're going to start our frictions. So I think in the past you guys were taught frictions as the scrubbing motion, going back and forth. But for this technique, we're going to do frictions with pressure only in one direction. So I will put pressure medially and then bring it back, medially and then bring it back. What I'm not doing either is I'm not sliding on the skin. So if you have oil or lotion on, removing some of that if you can. So I'll show you here, and we're going to do it pretty quickly and about a 1 inch or a couple centimeter amplitude. I'm going to start doing medial, medial, back, medial, back, and getting a pain value from your patient right away. So let's pretend she said that's a 3. See, my fingers aren't sliding on the skin, and I'm doing these quick frictions. Okay, so frictioning until there's a decrease in pain or decrease in tone. No pain is always preferable, but even if she only goes down to a 2 or a 1, we're just looking for at least that decrease. So frictioning longitudinally until we've got a decrease in pain. Let's say that's now. And then coming in cross fiber. Now it doesn't matter which direction you friction, but in this particular area, if I friction posterior to anterior, so towards the floor, I'm going to hit into that clavicle and it's not going to be comfortable, so I'm going to choose to friction the opposite way. So I'm going to come up, I'm going to do my quick cross fiber frictions. Again, checking in with your patient as soon or pretty shortly after you start it to make sure the pain is tolerable and to get a number to monitor. Okay, so let's say that was a 3. And we'll say there's no pain now. Sometimes when you're frictioning, just like with the trigger points, the pain doesn't seem to be going down. If that's the case, try using your frictions with a lighter pressure. And if I'm having to friction in one spot for more than about 45 seconds or a minute, I decide to try something else because you will make them bruisey and sore the next day. Now for the other attachment, I'm just going to grab the camera here and be bad and work with one hand. We're going to friction right off of that occipital ridge. Okay. So longitudinally, I'm coming in this direction. And here I just do this little motion with my fingers to do those frictions. You don't have to, you can move your whole arm, but you don't need to apply that much pressure usually in this area. So I'll do my longitudinal frictions here until that pain decreases, followed by my cross fiber frictions. I tend to go medial to lateral in this area, but you could go the other way as well until that pain decreases. Now what I should have shown you is a resistance palpation. So let me try to set this up again. Especially during the exams, we want to make sure that you know that you're in the right spot. So palpating where you think that attachment is, and then getting them very gently to contract the muscle, isometrically contract. If you get them to contract too hard, other structures will kick in and it'll be harder to palpate. So here I'm just going to bring my hand around. So can you just very gently push your head to the side? Good, and relax. So I feel that very gently flicker under my finger. And when I'm palpating the occipital attachment up here, I'll say just very gently push your hand up into or your shoulder up into my fingers. Good, and relax. And I feel that contract up here as well. Okay, after we do our attachment release, we want to follow it with the active and passive range of motion like we did with the trigger points. If you've performed, you don't have to stretch like you do with the trigger points. It's not wrong to do it. So if it's easier for you to remember, go for it. But you do have to follow with the passive and active range of motion. Now, if you've done both of these techniques on one muscle, you can just reset once at the very end for both of them.